fuse together and forms one bone, os sacrum, sacral bone. This bone has triangular shape, yes? An upper wide part of this bone, that is base, basis ossis sacri, and apex ossis sacri. Vertebral canal continues, here it is, into sacral canal, canalis sacralis. Dorsal surface has crests. This median Christus sacralis mediana, yeah, that is place where which vertebrae fuse together, which processes fuse together. Spinal processes, yes. Next crest is Christus sacralis intermedia, that is place where what articular processes fuse together. And last crest, Christus sacralis lateralis, it is place where transverse processes fuse. Yes. Laterally from Christus sacralis lateralis, here it is tuberositas sacralis. Then here it is articular surface, facies auricularis, because it looks like ear, auricular, that is facies auricularis. Then anterior part of the body of the first sacral vertebra has name promontorium. Here it is promontorium. These transverse lines, linea transversa, in places where bodies of the sacral vertebra fuse together. And these openings are foramina, sacralia, pelvina, because they look into true pelvis. And these openings, foramina, sacralia, dorsalia. This place where canalis sacralis opens, that is hiatus sacralis, and laterally from this hiatus, cornus sacralis. They are horns of the sacral bone, cornus sacralis, here and here. That is all about sacral bone. Next, ribs. Rib in Latin, that is costa, and it consists of bony part, that is os costale, and cartilage of the rib, that is cartilago costalis. Bone of the rib consists of head of the rib, caput costa, neck, column costa, and corpus costa. That is the body of the rib, corpus costa. Head of the rib has crest, crista capitis costa. This crest present only in ribs which joined with two facets, with superior and inferior facets in thoracic vertebra. That is why crest will absent in which ribs? Help me. It will absent in ribs which joined with complete fossa. First, 11 and 12. First, 11th and 12th ribs have not got crest, but ribs from 2nd till 10th have a crest of the head of the rib, crista capitis costa. Then tubercle of the rib, tuberculum costa, groove, sulcus costa. And most convex part of the rib, that is angulus costa. You need to identify, is it right or left rib? You need to take it that head of the rib looks backward and groove, sulcus costa, looks downward. It is right rib. Look here, if I take this way, what happened? Now groove is superiorly, should be inferiorly. That is only this way is correct. Okay. Some words about first rib. First rib, costa prima. It also have a head, caput costa, without crest, neck, column costa, tubercle, tuberculum costa, and tubercle here it is correspond to the angle, angulus costa. It have not got sulcus costa, but here it is, this rib is artificial, that is why maybe it is not so difficult, so clear for you. Here it is tuberculum, where anterior scalenus muscle attached. That is why name of this tubercle, tuberculum musculi scaleni anterioris. And in front from this tubercle we have groove of subclavian vein, and behind groove of subclavian artery. and all of these grooves should be superiorly. That is why it is left first rib. Head of the rib looks backward, and these grooves and tubercle superiorly. If I take in my right hand, these structures looks downward. It is wrong. Should be upward. Next, some words about sternum. Sternum consists of three parts: manubrium, body, corpus sterni, and xiphoid process. Processus xiphoideus in Latin. Xiphoid process is processus xiphoideus. Manubrium sterni joined with the body, corpus sterni, and makes angulus sterni. Some notches, unpaired notch, that is a jugular notch. Incisura jugularis or jugularis. Laterally incisura clavicularis, place where clavicle attach, and incisura costalis. Do you know how many ribs attach directly to sternum? Upper 7 ribs. They are true ribs. 8th, 9th, and 10th ribs. False ribs, costa spuria. Spuria in Latin, costa spuria, because they joined with cartilage of the upper rib. And last two, floating ribs, because they not attach anteriorly with another. Oh, they are free. They are free. Yes, they are free anteriorly. Sternum and ribs, they are long spongy bones. That is classification of these bones. Next, clavicle. Clavicle, that is right clavicle, consists of body, corpus claviculae, and two ends, extremitas sternalis and extremitas acromialis. The same, you need to know name of this tubercle. It has conoid shape, that is why tuberculum conoidum. How to identify, is it right or left clavicle? Extremitas sternalis is wider and extremitas acromialis is narrower. And body of the clavicle, it's look forward near of extremitas sternalis, and this tubercle looks downward. Look here, if I take in my left hand, what happened? Everything is the same, but tubercle tuberculum conoidum looks upward, should be down. If I change this way, now tubercle looks downward, but body of the clavicle looks backward, should be forward. That is why only this correct position. Here it is. That is left clavicle. Body near of extremitas sternalis looks forward, and tubercle looks downward. That is left clavicle, and here it is right clavicle. And last, scapula. Scapula, that is a flat bone. It has triangular shape, 3 angles and 3 bodies: angulus superior, angulus inferior, and angulus lateralis. Margo lateralis, margo medialis, and margo superior. Superior body has notch. How notch in Latin? Incisura scapula. 2 surfaces, posteriorly that is dorsal surface, and anteriorly that is facies costalis, because it's attached to ribs. Facies costalis has large fossa, fossa subscapularis, here it is. And dorsal surface, with the help of spine, spina scapula, that is spina scapula, and spina scapula subdivides dorsal surface into 2 fossa. One fossa above of spine, that is fossa supraspinata, above of spine, and below of spine, fossa infraspinata. This spine, spina scapula, continues into acromion. That is acromion, yes. And acromion, that is, participate in joint between clavicle and scapula. That is acromion end of scapula joined with, that is acromion extremitas acromialis of clavicle joined with acromion of scapula. That is correct position. Next. The same here it is, we have coracoid process, processus coracoidus. Lateral angle has cavitas glenoidalis, glenoid cavity, and this cavitas glenoidalis superiorly has supraglenoid tubercle and inferiorly infraglenoid tubercle. And this neck of the scapula, that is column scapula, column scapula. It is left scapula because facies castalis looks forward and glenoid cavity looks laterally. Here it is right scapula, the same facies castalis anteriorly and glenoid cavity laterally. Right and left scapula. Any questions? Please.
What is called this anterior part of this first?
Promontorium.
Promontorium.
Yes, promontorium.
Only this margin.
Yes, only this margin. Yes, that is anterior part of the body of the first sacral vertebra. Promontorium. Here it is.